meeting is being recorded.
Okay.
Well, hi everyone. Thank you for joining us. It's just 3:01. Um, give everybody a couple of minutes on this kind of if you're in Illinois on this kind of hazy day, hazy, hot, and smoky day. We're really grateful to have everybody join us this month. We're talking about the transition from pediatric to adult care, which is something that affects, so many children and families within the sort of pediatric and hospice palliative care world. So, Scott, do you want to bring up the slides? Perfect. All right. So as you guys, know, since you're since you're here and you're with us, welcome to the Illinois Pediatric Learning Collaborative. We have these monthly sessions in order to help kind of fill the gap in education for hospice and palliative care providers within the state. Creating networking opportunities and other types of educational opportunities for everyone. This month we are excited to feature a case, what we kind of have been calling a case conceptualization. This time is a little bit unique because not only do we have, a case to present, but we also have sort of a live case. We have a real patient and family with us, which is really exciting. I'd like to start just by kind of introducing the people who are going to be, talking and with us this afternoon. A lot of you know Dr. Michelle Miner already, but she is a professor of clinical pediatrics at SIU School of Medicine, specializing in pediatric primary care. She has a special interest in pediatric palliative care. She's the associate program director of graduate medical education in the Department of Pediatrics. Completed her pediatric residency and medical degree at SIU School of Medicine in Springfield, Illinois. Has a bachelor's from the University of Illinois at Champaign-Urbana and is board certified in pediatrics and a fellow of the American Academy of Pediatrics. So she will be, sort of walking us through a little bit of the information around the transition from pediatric to adult care, and actually was one of the providers who helped care for Brianna. And so to introduce Judy Vlach and Brianna Vlach. Brianna is a very joyful 24-year-old who loves music, Disney, watching movies, spending time with her parents, who she lives with. She was born at 34 weeks, weighing 3 pounds, 14 ounces. After a hard-fought 2-month battle in the NICU, she came home, and when she was 6 months old, she was diagnosed with a rare syndrome called Marshall-Smith. There are currently only 68 documented cases in the world, so certainly one of a kind. And Marshall-Smith presents with several medical challenges, extensive dependent care, and a life expectancy of 18 months. As I said at the beginning, though, Brianna is 24 years old, so she has never allowed any of these things to define her journey. And through an amazing medical team and her family and all sorts of care, she has shattered all of the expectations. She lives each day blessed with her spunky and determined diva attitude, and is a blessing to her parents and all those who meet her. And we are really grateful for Judy for being here to share Brianna's story with us, and for Brianna, who made a little bit of an entrance in the beginning. She may maybe she'll pop in again, but she's got places to go and people to see, so we understand that as well.
All right. Well, thank you so much. We are just going to chat a little bit about some different areas of guardianship to think about. This is obviously a huge topic, and each area could be a talk in and of itself. But just a little sampling. We're going to talk about some different areas to consider when a patient is transitioning from pediatric to adult medical care. We're going to talk about the role of academia during the transition process. We'll talk about some parameters around guardianship and how that process is navigated. And then the highlight will be talking with Judy about her experience helping Brianna navigate that transition. Next slide. All right, so let's start with just kind of an overview of transition. This this is really a vulnerable time. Anytime we know in healthcare that there is a transition of care, it's a vulnerable time. It's a time that there's potential for information to be lost or things to be dropped. And the transition from pediatric to adult care is often a very abrupt one. Sometimes it's dependent on a school academic calendar or on a birthday, but there's often a very abrupt change in services that has to happen. There can be a loss or a change in providers, in therapies, nursing care, insurance coverage, and then there's also brand new relationships. Oftentimes, children for whom we're thinking about a guardianship plan, they often have a whole team of people who have been caring for them for a while, and we've built relationships and trust and gotten to know each other very well to care for the young one, and then starting kind of all over with a whole new team of providers can be really challenging. And then we also have to sometimes, depending on the family, we're as providers as well as parents are getting older as well, and so sometimes just challenges in taking care of an older, physically bigger child can be a challenge as well. So next slide. So I don't need to say this process can be very overwhelming for parents and caregivers. And there are transitions in a lot of different areas, and there are a lot of barriers that exist in each of those areas. There can be differences in how providers or different agencies provide services or approach a particular problem or situation, and that can be really jarring for patients and families. And then we're having to say goodbye to some of those relationships that families have built for quite a long time. And sometimes, we're lucky enough to catch each other in the checkout lane at Walmart and be able to catch up real quick. But sometimes, that can be a loss as well. The slide on the left kind of shows different facilitators, different things that can help that transition process, and really communication is key. This is not a quick one and done, check, you're transitioned, good luck kind of appointment, but really should be a process with everybody involved, with communication, with setting expectations and trying to have services lined up as much as possible. Next slide.
Okay, so I'm just gonna jump in and talk about a couple of other areas that they will that pediatric cases that are transitioning to adults will experience. And so obviously you have the medical professionals, and some ideas for the providers out there will be to make sure you're talking to the parents about insurance coverage so that anyone that's referred to them or they go to will be covered, so they're not accruing unforeseen financial concerns. You have, you have to, you're using if you're in the psychosocial aspect of a pediatric palliative or hospice care team, you're talking to them about working with their current providers. What are the recommendations you have? It doesn't necessarily mean that those recommendations will have room on their caseload or can accept a case, but it is nice if you are a provider to know different specialists that do, or even to look at the complex care specialists in your area so that you can get them in contact with them. One of the things that is important for, I think, anybody who works with pediatric cases to know is that the healthcare power of attorney is going to be something that is imperative during this process, especially for individuals that may not be able to articulate their desires. And I'm talking about the patient. So if you have a patient that is minimally verbal or nonverbal, or even patients that may need that assistance, going through a healthcare power of attorney should start around 17 and a half years old. Now, the healthcare power of attorney in the state of Illinois does not require it to be notarized. However, I would encourage you to consider the importance of that when you're working with your patients and families. And so if you have the issue here becomes if you have somebody who's a patient who's nonverbal, this process becomes a little more complicated because if you go or there's limitations to mobility and that patient is required to be in the house a majority of their time outside of medical appointments, this may be hard to get to get it notarized. So you may have to look into that, but that's something important. Now, if you're in a DSCC waiver program and if you're in the medically fragile and technically dependent, you can be in services and you have to sign up for services before 21 years old. And then my understanding is that you get to keep those services and for the rest of your life. Now, the non-waiver program is different, where I believe those cut off at 21. So if you're on the medically fragile and technically dependent, it remains. If you're on the non-waiver program and get nursing as a pediatric patient, that only lasts until 21. And then obviously the core program would not allow you to keep nursing after that. So if you have somebody who doesn't have nursing, you might want to consider looking into DOORS, which is the Department of Rehabilitation. They have the same program that works with adults. So obviously this patient will be becoming 18. This allows the parent who has never likely not been able to be paid, or the family didn't qualify for the DSCC medically fragile and technically dependent waiver. This is a way for that parent who may have had to terminate their employment in order to meet their child's needs, for them to get some compensation for that caregiver role. Anybody who becomes 18 can choose they call them personal assistants or PAs. So you could have a mother, a father, you can have a sibling, grandparent, anybody who's able to fill that need. You also might want to consider SSI at that time. That application should start somewhere. They can't process it until the day they turn 18. But if you look at Illinois ABE online, we'll give you the resource later, but that's where you'll ask for medical insurance, Medicaid, stuff like that. And then, of course, there's the PUNS list. You do have rehabilitation therapies. Hi, Rihanna. You do have rehabilitation therapies. The reason I have this on here is because once you hit a certain age, individuals coming into the house becomes harder, because most places that you think of will be, oh, I'm sorry about that. Most places that work with pediatrics are understanding that their work is for a like to slow down disease progression and maintain skills, whereas for adult therapists, they're usually working towards getting better and may have concerns regarding getting into the house for stabilizing disease progression. So they need a strong advocate for that. And then the DME services, a lot of places for wheelchair fitting and things of that nature are rooted in pediatrics for our pediatric hospice and palliative care program. So it might be more difficult for you to get the proper sizing and fitting for things of that nature. So just know that these processes take a little bit more time and require a psychosocial team that's diligent in their follow-up and advocacy in order to make sure the families are getting their needs met. And then we're going to have a quick conversation about the role of academia. And this is specific to Illinois, but what the Illinois, what ISB would say, right? Illinois School Board of Education would say is, if you're looking to transition a patient with special healthcare needs into more of a long-term academic experience, then you should start that around 14 to make sure that they have the services they need. And so, but they do warn that whenever you turn 22 in the state of Illinois, you can no longer get any services from the school district. So if you're working with a patient that is technically in their senior year age-wise, you would be talking to them about whether or not they want to assume their diploma. Once they assume their diploma, they have graduated out of the school district services. If you tell them not to, if they decide, I should say, and you give them the options and they decide not to assume their diploma, they can continue to get services, whether it's a transition program as documented here or some other program of the sort. They can continue to get those services until the day before their 22nd birthday. So that includes continuation of occupational therapy, speech therapy, physical therapy, or anything else that's involved in their IEP. Now co-ops, which like Sidell up here in Lake County, and some of your other programs that are not focused on academia for the education, they're more focused on skill development and have therapies rather than a lot of academic classrooms. Those programs are already familiar with this process and will start it very early. But if the family is looking for the ancillary therapy, it is a good conversation and a way for them to continue those services.
So from the physician perspective, if you have a child for whom guardianship might be the option, this is a legal process that is done through the court. And it varies a bit by state, but essentially there are two main categories. There's guardianship of the estate, so finances, any property, that sort of thing. And then there's guardianship of the person. And that talks about living arrangements as well as medical treatment. And I went ahead and put a shot of the recent policy statement from the American Academy of Pediatrics about guardianship and things to consider as well as alternatives. The way the medical system is set up is essentially the day a child turns 18, they are responsible for their own medical care. It is presumed that they can make their own decisions unless something is put in place that says otherwise. And so this is another area that starting really early can be helpful to get everything that you need in place in order to have the services and supports in place that we need. And sometimes it's a relatively straightforward process. Sometimes there is a youth who is not able to function on their own. But there are lots of patients who are sort of in between. And so there's really a need to balance not only the appropriate support that they need, but also respecting their autonomy and preserving their own rights. Once somebody has guardianship granted, it really is extremely difficult to reverse. So essentially, you're deciding that you're taking away their rights to speak for themselves for the rest of their life. Fortunately, many states, including Illinois, have put things into place where there are alternatives to full guardianship. So next slide. If you proceed with full guardianship, this is what is required. So like I said, it's a legal process that is done in the court. Usually physicians will obtain an attorney, and the physician is asked to fill out this form from the court that basically describes what their disability is, how it impacts their ability to make decisions, how it impacts their ability to function independently. They will request results and interpretation of anything within the past 3 months that speaks to their physical condition, their mental health, their social skills, their level of education, their adaptive skills, what kind of, and just daily function are they able to dress themselves and go shopping and manage money and that sort of thing. They will ask the physician what their opinion is regarding whether guardianship is needed and what their recommendation is as to the most appropriate living arrangements for that person. Next slide. Illinois has supported decision-making. This most recent version was effective in 2022, and it was designed for adults with intellectual and developmental disabilities. That basically is a written agreement that says we are going to make some of these decisions together, whether it is specifically about medical care or financial decisions. Ultimately, it is up to the individual to make the final decisions. But even something like arranging a joint bank account or just having supports in place when appropriate could be an alternative to full guardianship. Scott talked about the power of attorney for healthcare to ensure that there are supports there for making those decisions. And then another important piece is estate planning for the parents, so that as parents age, making sure that should something happen to them, the youth continues to be supported and taken care of. Next slide. All right, so I am very excited